Hi, welcome. I'm Dr Khaled Sadek, and you're watching my fantastic YouTube channel on cysts and lipoma removal. In this question and answer session, we're doing a live global chat where we're taking questions from viewers all over the world, primarily around the cysts and lipoma section, but also much broader, encompassing what we're currently having globally, known as COVID-19. So if you've got questions about either cysts or lipomas, or if you've got concerns regarding coronavirus, or you'd like information on how to stay safe, then this is an opportunity for us to discuss this in a live platform. I've tried to use my channel with its fan base to send out as much public information, helping people around the world to try and stay safe. And I hope that if you haven't seen those videos, you're able to log on and view those as well. I've published two videos. Yesterday we did one on vulnerable individuals. So those individuals that are classed as being highly vulnerable, and they should seek social distancing and even social shielding. And this video recently released encompasses how to wash your hands thoroughly. So if you've got questions regarding either of those videos, or something we haven't touched, or something that you want us to cover, then let me know. This is the opportunity to do that. So we'll open it out to the floor. Let's see which questions we've got, and we'll begin. So Natasha Khan is opening the floor. She's asking, do we think this is biological warfare? That's an interesting question. The coronavirus is certainly biological in origin, but in honesty, it's most likely going to be a natural phenomena as opposed to a lab-based espionage or chemical biohazard accident. So it's certainly biological. I don't believe it's warfare because it's affected everybody equally. Is this self-inflicted? Yes, I think this is less self-inflicted, probably just something that was going to happen irrespective of what we were going to do. Next question. I hope you're well. So one of the big questions that came up was how to wash our hands and what to wash our hands with. Now, a lot of people are going out there and they're buying a lot of hand gels, using the warm water to bring up a nice wash. Make sure you're washing between the fingers, washing your nails, washing your thumbs, washing the wrists, making sure you do that for 20 seconds at least, and several times a day. So I would recommend, if you're going out, you put the hand sanitizer on, make sure you get the high strength alcohol gel to just wash away the viruses. And when you come back in the house, wash your hands as well. As we approach the peak, you may also need to just have a shower when you come in from outside. It's important to then wash your clothes in the washing machine, perhaps even daily in those cases. Even more so if you are living in a household with individuals who are more likely to suffer illness if they were to contract the coronavirus. So those are two important issues there. Other issues you might wish to consider also is working from home. So if you're able to work from home, then you must continue to do so. There are certain sectors of society where that isn't possible, and certain individuals where that might not be possible either. So think about the journeys you're making outside the home, reduce them to the absolute bare minimum. Don't go out daily to do a shop. Aim to sort of have it maybe once a week where you do a shop. Reduce unnecessary travel. Limit it to perhaps purchasing food, seeking medical advice, or helping an ill relative. If you are in a high-risk area, you may have to do even more drastic social distancing, and that means no groups, no gatherings of more than 2 individuals at a time. Reducing your daily exercise routine to just once, perhaps a day. And also not mixing with other households that aren't related to you, because that increases the risk as well. Now, the information about the coronavirus is coming through. The scientists, epidemiologists are telling us a lot more. So we know that it has an incubation period of about 2 to 5 days. And one of the first symptoms is a fever, followed by sore throat, a cough, and a headache. Individuals really have a really kind of strong flu-like symptoms where they may have muscle aches, joint pains, and the period that this Flu-like illness will be about 7 days. In some cases, you may have, in another subsect, you may also have loose stools, diarrhea, for instance. In the more severe, moderate to severe, you will require hospital admission. So it's where breathing becomes a lot more labored and a lot more difficult. And sometimes you'll need a little bit of extra help. If you're worried about your breathing and you don't know how to judge it, there are techniques to try and work out how good your oxygen levels are. One of those is the Roth breathing tests. And what you do, you take a deep breath in, and then you count to 30. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, and so forth. And you see how far you can reach. If you can get all of that done in one breath, fantastic. You've got oxygen levels, really good levels. You may remember that your doctor uses an oxygen probe on the finger and a pulse oximeter, and he gives you figures of 90% to 99%. We know that if you can go all the way to count to 30 in that single breath, and you're going over 98% oxygen saturation. If you're only getting to the low single digits, say 8, 7, 9 before you run out of breath, your oxygen levels are very, very low. Very low. And we're talking about levels below 95 to 90, requiring hospital attendance. So it's a good yardstick to gauge your oxygen levels. Now remember, some of you may also be isolated in terms of accessing medical care. So things to have at home are some paracetamol, a blood pressure cuff, a pulse oximeter, and a thermometer probe. Therefore, if you were to undergo a consultation with a physician that is remote, that's to say it's over a video link or a telephone, you'll be able to have the equipment that they've got in their office to test yourself so that you can things to have at home. Your physician may also ask you to take your blood pulse, your pulse rate. And it's very easy to do. You find the pulse, it typically just runs across the thumb over here, what's called the radial artery. And you can just feel it with 2 fingers. Do not use your thumb. Just place the finger gently just over where a watch strap may be, and you'll be able to feel the pulse. Ideally, we want the beats per minute. So you only need to count to 15 seconds and then multiply that by 4. So for instance, if we count it, so a very easy test to do. Children are less at risk. We know that they are carriers and they can get infected with coronavirus. However, they seem to manage it well. However, they can pass it on to elder members of the family, such as grandparents. So as schooling becomes more home-based, we must remember that children are vectors of this virus. And so contact with elders must also be reduced. So let's take some more questions. I've spoken a lot. Let's see some more questions. Let's scroll back up. Hello from Florida. That's Jean. Tyja says, Doctor, are you staying safe from the coronavirus? Yeah. We have paused our minor surgery clinic, so we're not doing cysts and that kind of surgery. And we're really focusing on the state health service, the NHS. So all of my efforts are going into supporting the state health service. We're doing a lot of remote telephone consultations, and we're trying to provide as much support in the community so that the system doesn't collapse. I'm diabetic, says Betty. Am I at higher risk? Yeah, so diabetics, irrespective of age, will be at the higher risk category. So anybody with metabolic disease, so that's to say diabetes, hypertension, that's blood pressure, cardiovascular disease. So if you had a heart attack, like a myocardial infarction, or whether you've got degrees of heart failure, or whether you've got an increased body mass, so you're a little bit obese, if your BMI is elevated over 35 and 40, then that will increase your risk of morbidity and mortality if you're to come into contact with the coronavirus. Gibby's wife, hello, that's Laura Spritz. We need to follow suit with South China and India. Yeah, absolutely. I think social isolation, restriction, distancing, closing down gatherings. In the United Kingdom, we've actually closed cafes, restaurants, cinemas, bars, pubs, takeaway joints. We've also closed non-essential shops, so things like department stores, electronics stores, using social distancing. So it's a very small number of individuals going into the shop, and once in the shop, 2 meters separation between customers is also important. Claire from Michigan, news report, US might be the new epicenter. Do you think this might be true? Well, it does seem to have this sort of a pattern that there are hubs of the coronavirus. Wuhan in China was the first epicenter. That moved over to the Lombardy region of northern Italy before spreading to Italy as a whole. We're seeing that now over in Madrid and Germany, and also here in London and United Kingdom. So where Wuhan was the epicenter in China, we saw that moving to Italy. It's now branched out to Germany, mainland Europe, and it's also here in the United Kingdom. And we're really looking at the low foothills of this exponential peak before it grows up. And I suspect America is following a very similar trend. It's not so much the testing numbers. What we go by is the actual mortality numbers, because we know that approximately 1 death equates to about 1,000 infections, and then that gives you a rough estimate of the prevalence and the incidence of the coronavirus in the population. Dr. Sadek, I have a quick question. My friend advised me only to use gel rather than wash with a bar of soap. There are no more hand gels? Sululali, thanks. That's a very, very good question. It's actually advisable to wash your hands simply with a bar of soap, warm water, as I've demonstrated in my video. 20 seconds, several times a day is absolutely sufficient. If you don't have hand gel, don't worry. It's not the end of the world. People have panicked, bought lots of it. A simple bar of soap is just as efficient. Next question. Don't forget to clean your cell phone. That's acrylic pour. Absolutely. So surfaces are harboring this virus. So it's not only airborne, we don't only just breathe it in, but it's also on surfaces, and certain materials will be able to harbor that virus longer than others. So there is an estimate about 3 to 7 hours, depending on whether you are sort of like a wood surface or a stainless steel. All a scrub down and give it a clean. Are you doing the stay-at-home orders, or are you in the States, or should I say Ohio? So here in the United Kingdom, there are stay-at-home orders for the whole population, for the exception of essential key workers. They include doctors, nurses, pharmacists, transport drivers, the police, the judiciary service, people in social care, certain groups of teachers. So there are groups of people who should go to work where they can possibly. If they can work from home, even better. And obviously for the rest of the population, they're advised to work from home or stay at home altogether. So do you recommend vitamin C, zinc, multivitamins to boost your immunity? That's Janelle. Janelle, that's a very good question. Zinc, vitamin C, always very good supplements to boost your immunity. But on top of that, you must eat well, you must sleep well. And if you do those core things, your immunity will be bolstered. We know that if we have poor sleep, we feel run down, our mood is low, our performance is low, our memory is low, and more importantly, the body itself is physically weaker and your immune system will shrink and you'll be prone to developing infections. So make sure you sleep, don't panic, get some sleep, and God willing, everything will be fine. Next question from the floor. How soon can Corona change into a new form? Okay. That's a question from Dana. It's a good question. So the coronavirus is actually, it's quite a short sequenced RNA. You may remember in science that there's a word called DNA. So that's a double-stranded nucleotide chain. But this particular virus is a single strain of DNA sequence, of amino acid sequence, and it's very short. Now, if you have something that's very short, replicating very, very fast, it's invariably going to make errors. So instead of doing a skip, hop, skip, hop, skip, hop, it may do a skip, skip, hop. And that skip, that error in replication is called a mutation. And if you are mutating millions and millions of times a day, then there is an increased chance that one of those mutations will be a little bit more potent than the original one. So the original flu vaccines, until we know which one is coming through, and each year the vaccine is different because the virus will mutate accordingly, and that's how they do it. I've developed croupy-like dry cough, headache, and a low-grade temperature. That's Sarah McAlpine. So Sarah, you can get a test done to see if you have contracted corona, but the overall medical consensus is that if you've got a low-grade temperature or a cough, then you should take that as being corona positive, and that you should seek to self-isolate for 7 days. If you're in a household with an individual who's got those symptoms, then you should isolate for 14 days. Those are the guidelines that Public Health England have provided here in the United Kingdom. So if you are getting those symptoms, then you should assume that it's to be corona, and you should take steps to quarantine yourself to reduce the risk of spread, not just to your loved ones, but the general population. Next question. Someone needs to tell Americans to stay at home. I think everybody needs to stay at home, not just in your locality. It all starts from us. We are staying at home. You do the same. What do you think about colchicine helping with cytokine? That's from Hensley. So colchicine, we know, is a gout medication. It's used to fight inflammation of the gout. I think when it comes to corona, there's a lot of drugs, there's a lot of speculation, there's a lot of unknowns, a lot of unknowns. I wouldn't start experimenting with all sorts of drugs. What you should do is that if your symptoms are mild to moderate, you should self-isolate. But if they're worse and you're struggling, then you should seek medical help straight away and not try and self-prescribe medication. Will using sanitizers help? Yes, absolutely. Can you get it twice? So Gibby's wife, that's a good question. Can you get it twice? We don't really know. There have been some anecdotal stories coming out of Japan where a lady tested positive, going into hospital, tested negative, coming out, and then redeveloped symptoms and tested positive again. At the present moment, we don't know whether this is a problem globally, but what we do know is the risk to the individual depends on the viral load. So if you're exposed to a lot of this virus, your immune system is going to become subdued. Whether you develop an immunity that's long-term, further viral load, then it's most likely that that's going to come back again in a milder form. Absolutely. I'm in Chicago and have the COVID-19 virus. Your smile is brightening me up. Michelle from Chicago, thank you. Sensory temporary impairment as well. Absolutely. So Natasha has mentioned the loss of smell and taste. Okay, I'm 66, living in an adult community in New Jersey, which has a stay-in-place effect. Am I higher risk? If you don't have any comorbidities and you're under 70, you're not necessarily at the most vulnerable group, but you may be living in a community which is susceptible to infection. So you've got to think about not just yourself, but also the herd that you are living in as well. Hi, Doc from the USA. I've COPD and congestive heart failure. This virus is scary, says Deborah. I'm a retired nurse of 33 years. Deborah, you've served us well and we'll serve you well. So stay at home, protect yourself, have friends to deliver food, medicine, supplies as you need it. Reduce your contact with the outside world. Remember to wash your hands as frequently as you can. Drink lots of fluid. Flush that virus out of your mouth into the guts, because it's not going to do you any harm if it's in the gut. We don't want to breathe it in. So if it's in the airways, you drink, it'll flush our way. Okay? Michelle from Chicago, get well soon. Tracy says, I'm having trouble breathing today. Should I be worried? Tracy, contact your local physician. Get their advice immediately. If I can't count to 10... okay, so the UK has some grocery deliveries. Tesco, for example, the United States has Safeway. Absolutely, yes. So use the online delivery services. Do you have 3 or more symptoms? I really appreciate the hand washing video. Thanks, guys. Yeah, if you liked it, like it. If you haven't seen it, go back and watch it. We'll just scroll through some more of these. Can your respirations be at the normal saturations, or do you go hand in hand? Yeah, so your oxygen levels will be representative of your total lung function. I'd like to pay attention if things get worse, absolutely. I don't have a question, but thank you for the information. Thank you, Sandfire. Let's have a look. do I look do I look more like my mother, or do I look more like my father? I get, I don't get Italian. I can only do it for Google Translate. I feel that the cure, Dr. Khaled, my granddaughter, fantastic. Be careful. I heard well. So lots and lots of questions. I'm going to try and get as many of those done. If not today, I'll do a live chat tomorrow as well. Let me know in the comments down below which topics you want me to cover in the tutorial, in the medical information videos regarding corona. So like I've said, we're going to pause the minor surgery. We're going to focus on putting out as much information about coronavirus to everybody so that you can feel reassured, that I'm here to give you information. So until next time, everybody, hope you stay safe. If you have any questions, please get in touch with me either on Instagram or on Twitter. You can ask me questions on Twitter or in the comments down below. Okay, folks, till next time. Bye-bye.